Friends, Michael Lesh and Darren Cooke, who are the two speakers for today's Catalyst program fall translational workshop. Um, Today's focus, it's really on trying to help the Catalyst professors and postdocs and other PIs that have applied for Catalyst awards to, let's say, make sure they emphasize the product development and the commercialization opportunities for their projects, as well as the, underlying um, great science and engineering and technology. So Michael is going to speak first. Michael's was an engineer originally, went to medical school, became a cardiologist, and when he was on the faculty at UCSF, like I know it's over 30 years ago, he developed the cardiac electrophysiological technique to ablate AFib, and that led to a company. That company ended up getting acquired, and since then, Michael's founded several other companies. They're outlined in the flyer I think you all got, and he's also back on the faculty at UCSF. Darren Cooke was an attorney, or is an attorney by training, and is currently the vice chancellor for innovation at UC Berkeley. He also created the relatively new Life Sciences Entrepreneurship Center, LSEC, at UC Berkeley, and he teaches for NSF Corps. He teaches at the Haas School of Business at Cal as well. And so we're really lucky. I've heard both these people speak several times each, and I think we're really lucky today to have both of them. So Michael Lesh is going to start off. They both have almost a half hour each, and then I'm pretty sure they'll both be leaving some time for questions, but feel free to type those into the chat, and we'll make sure they're tackled. And so without further ado, Michael, take it away, please.
Sure. Thanks, Charles. And glad to see everybody here today. You know, I'm going to have a relative, I would say, narrow talk because my talk is about the people who want to commercialize what they're working on. And by commercialize, I mean you take all the work you're going to do now and what you're going to do over the next 5 or 10 years. And the goal of that is to create a product, commercialized entity that will help patients, right? That's really why we're here. Some of my talk will be a little didactic, but mostly it's soft and fuzzy. I do a lot of mentoring. I've probably mentored hundreds. And one of the first things I ask is, what do you want to do? What do you want to get out of this? So this is not just a didactic talk on kind of here are all the steps along the way, but here are the steps and how do you fit into those steps? Why do this? So let me just start. Let's see. I know there's a way to share a screen, isn't there? I believe so. Okay, here we go. And slideshow. So, and you'll hear this in every talk around innovation, is that you need to start with an unmet clinical need. And by unmet, I mean you've done a bunch of research, you've looked at the patent literature, you've looked at the commercial products that are out there, you've gone to the meetings, and you're really sure that this is something that nobody has been successful doing. The next thing is there really a need, right? And all too often I see people who like in their head say, oh, I've got a great idea. And that becomes the genesis of the need. You know, in any of these startup courses like the one Rupa runs, you've got to talk to 50 customers, right? That's kind of the threshold number. So you really need to decide that there's a need. And, you know, the other piece of this, is there a need for you? Because when I started the AFib ablation company, I was practicing electrophysiologist. We were starting to try to ablate atrial fibrillation. I would sit there with a catheter. I'd spend 8 hours. It was half unsuccessful. And day after day, you know, sitting there under fluoro, moving a catheter around. And that's when the aha moment. So you in the healthcare space, especially physicians, but not necessarily, you have an amazing opportunity to find the unmet need in what you do on a day-to-day basis, right? So I think that's very important. And then, lastly, like, is this an important unmet need? Will this change healthcare if you are successful? Don't be a hammer in search of a nail. A lot of you guys do great research and you want to apply your research to some problem. And, you're going to go find the problem and you're going to apply your research. Really, the best ideas, the ones that are successful, is when you start with that unmet need. Um, this is the hammer of the moment. AI. Everybody thinks that AI is the next holy grail. When I uh, just reviewed the Catalyst digital grants and even the device grants, most of them, not all of them, related to AI. And it's hard for me to believe that every single one of the problems that people are addressing now were not problems before AI. So somehow, if these were problems before, why is AI the solution? So just be careful about getting onto the whatever the most recent bandwagon is. And right now it's AI. I think AI has some incredible applications, but really make sure that you're thinking about what those applications are and whether AI is truly the solution. Um, this is something I really want to emphasize, and it's the concept that an inventor and an innovator and an entrepreneur are very different things. And probably most of you on this call are at least inventors. You have some idea, you're the creative genius behind that idea, and you're going to disclose that to the tech transfer office to complete, you're part of the inventor element of bringing a product to market. Then there's the innovator, and maybe a lot of you are the innovators as well, where you have this research finding, and you found an unmet need, and you're going to like practically build that or put that in place or experiment with it. So you're the problem solver. But the entrepreneur is the person who really brings all of that to the market. They execute, they build the business, find a team, find financing, research and development, regulatory, go to market, etc. So, not that you necessarily all are going to be entrepreneurs, but I just wanted to help you understand kind of the range of activities that have to take place. And, if you look at it in terms of the contribution to success, the inventor is maybe 5%. The innovator, the guy who does the initial experimentation, is 10%. The execution to actually make this into a commercial product is at least 85%. I've seen a lot of folks come into tech transfer and say, oh, I got an idea, I'm the inventor, and they think that it's immediately going to be a company. No, the invention is about 5%. It's all the rest of this that requires the hard work. Um, Now, the other thing I want to emphasize is you need to understand every step along the way from here to actually commercializing. And it's not that you're necessarily going to do all these things. It's just that if you are going to be able to solidify the pathway from here to there and be able to communicate that to colleagues, to investors, to companies, you need to learn sort of this whole this whole set of skills. Again, there are many courses. The Rupus course teaches this, but unmet need, intellectual property. What is your moat? You'll constantly be asked this, like what differentiates you from other things that are out there? How do products get developed? What is the regulatory? I've seen a lot of folks with really cool ideas, and they have no idea that there is such a thing as regulatory approval, much less medical device versus drug, much less class one, class two, class three. So you have to understand regulatory, financing. You need to know what kind of clinical trial whatever your drug or device is going to entail, reimbursement, go to market strategy. Learn all of these things now. Don't wait, because you will, even though you're not going to implement this, you need to have a convincing story about why you will be able to get this thing into the market. There are lots of educational resources out there. There's lots of classes. Um, I like to point people to Y Combinator. They have a great set of videos. Lecture one, how to start a startup. I don't know if you recognize this guy on the left, the lecturer there at Stanford. This was 10 years ago. Um, this is when Sam Altman was head of Y Combinator. And I think he's gone on to do good things after that. I haven't checked recently, but lots of resources. Write a business plan. This is the next step. You can say like, well, I just got an idea. I just submitted the grant. Write a business plan. Why? Because you need to be able to think through that entire pathway from now until commercialization. And a business plan is a very good way to consolidate that. It might say like, well, why do that? Well, look, let's say you're working on a device and the device could be a 510K or it could be a PMA, depending on the characteristics of the device or how you label it, what your goal is. Well, if you want that thing to get to market early, you want it to be a 510K. So what you develop today may be dependent on what your regulatory or even reimbursement strategy is. That's why you need to know all these things today. And that's why a business plan is a good thing to do. People are the second most important thing besides a great idea. Um, Find and inspire people who are not in your field. It's a lot easier to do this now with LinkedIn and et cetera, but you need to have contacts to investors, business people, industry people, friends and family who might be investors, on and on and on, not in your field. You'll have a lot of people in your field you can talk to, but it's making these connections that's super important. And that's also why you need to have this complete story of where you're going. Because for you to find and inspire people, you need to be able to give them the whole vision and even, a 1 minute sales pitch. That I think Darren will help you with. So you got to turn to yourself. What do you really want to achieve? Starting a company, what people call starting a company, is kind of a spectrum. Uh, you have an idea, you continue in your lab, you hand it off to tech transfer and say, go do something, build something, license this. You might get early grants and accelerators, hence Catalyst. Um, Beyond that is this idea of finding a founding team. You're not necessarily a business person, find a business person. The optimum number of founders is not one, not three, it's two. You need to have two solid founders with complementary skills, and you start to do that soon. Now, the next step, let's say you have an idea, you got through Catalyst, it's looking good, maybe you even have a grant. The next step along the way would be, okay, well, I'm going to reduce my academic load, I'm going to take a sabbatical, and I'm going to focus on that startup for a couple of years. The next step along the degree of involvement is an operating co-founder. So you leave your academics or you cut it way back, become the chief medical officer, or really you burn all the boats, you become the founder, CEO, you lead the company. Now, the chance of success of actually achieving a successful company is inversely proportional to where these things on this list. And the reward that you will achieve is inversely, and I mean both personal rewards as well as economic rewards. Now, the sad fact is that if you want investors to eventually invest in this, and I'm talking about venture investors, this is not angels. Angels will never get you to a product. Um, they really want to have the founder involved in the company, very involved, maybe part-time for a couple of years, but leaving academics and joining the company is something that most investors will expect. It's not 100%. This is just, in my experience, what I've seen out there, and many investors will say this. If that inventor, if that scientist is not involved, I won't be able to get people, I won't be able to get funding, and I won't be able to get the project done. Talking about financing, most people are shocked at how much money it's going to take to bring your project, your innovation to the market. 250K, 120K from Catalyst is a very, 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 very small drop in the bucket. Even digital health, assuming that it's not, a consumer-based app, if it's going to require some FDA approval, et cetera, It can take 3 to 100 million. The Zeo patch, which was a digital rhythm recorder, took I think about 150 before they started selling. And the development time is not instantaneous. Medical device, you multiply that by 10, and pharma, biotech, you're talking about a total amount of funding that has to be raised between now and the time you hit the market of up to $1 billion or even more, and take a decade or even more. So just understand that if you are working on a molecule, a receptor, that this is what it's going to look like in front of you before that thing actually gets to the market. What are my chances? Well, uh, again, I don't want to be discouraging, but I like it when people look at this and say, this is bullshit. I don't believe you. I'm going to go ahead and do this. And those are the people who are more likely to be successful than the ones who say, oh, gee, this is not for me. Um, Financing for health tech companies peaked in 2021, and it's going down and going down and continuing to go down. So it's going to be hard to get your brilliant idea. Uh, what are my odds? These are some really interesting statistics that are kind of hard to get a hold of, but this is UC wide, 2000 to 2020. There were 3,500 disclosures, 1,400 startups. That means a startup found a formation of 4.1%, and the chance of ultimate success is about a tenth of that. So 0.4, less than 0.5% of disclosures actually wind up in startup companies. And the other bad news about this is that most of the success comes from a very small number of successful companies. A lot of this is luck. Some of this is the result of litigation. The prostate cancer drug from UCLA. I don't know if any of you know why there's a hepatitis B vaccine still getting royalties. I don't know if anybody knows that, but there's a big building some of you may be in called Genentech Hall. Well, Genentech, UCSF UC sued Genentech early on because technology was taken out of UC, and that built Genentech Hall and continues to generate royalties. Um, there's the ablation device for treating AFib. That's mine. The only medical device in any of these. So again, tough road. So why become an entrepreneur? Why, really try to take this all the way to commercialization and not just, submit a grant and see how it goes, and then go back to your lab? Is that you have the passion. The people who are going to be successful, they basically can't not do this. They wake up in the morning and this is what they think about, and they're willing to do this for as long as it takes because there's a mission. They're mission oriented. The world needs the thing that is unmet, and they're going to solve that problem. And for each individual trying to make this decision, this will be the hardest thing you ever do, but by far the most rewarding from an emotional and potentially even an economic standpoint that you'll ever do. So I'll stop there. And
Hey,
that's
hey, thanks so much, Michael. That was really eye-opening. I mean, I'd heard a I'd heard a lot of that before, but just the way you said it and how you said it was really great. So I'm just looking at the screen, and so does anyone have a question for Michael Lesh on the call? I'm looking at the screen, so if you just either shout it out or raise that little raised hand, and we'll call on you. Um, any questions for Michael?
I hope I didn't scare everybody off. I laid this down as a challenge for all of you because I know that on this call there are several people who are going to create great things that are going to help patients.
Okay, I got a question. So you had that dramatic slide. You had that slide that said, "Oh, there's 5 different scenarios for when an academic has an idea and it might get commercialized." And the top, went down the list. And then you had that giant red X, and you basically said, "Well, look, if you're going to get financing, venture financing, not angel financing, the financiers are going to want to know that you've got skin in the game, and this is your baby. But what is your advice to, let's say, UCSF professors that are like, oh, no, no, I'm committed to this. I want this to succeed, but I still want to keep my professorship. And maybe I'll take a sabbatical, but what's your advice to the professors that don't want to do what you did and go all in, but rather keep their day job, but really help the startup coming out of their lab to the extent that they can while keeping their professorship?
So, um, I'm I'm not actually giving advice. I'm giving statistical likelihoods. Okay, so the companies that I've seen be successful all the way to the end are ones where the founder generally was in the company the whole time. Now, you don't have to be there the whole time. Yes, you can do 2 years and kind of go back to your lab. The chances of you maintaining your goals as to what that company will become diminish with each passing year. Your ownership percentage diminishes exponentially with each passing financing. So if your idea is you want to control this thing, you want to make this happen based on your efforts, yeah, do 2 years, get some financing, um, and go back to your lab. The chance of success is low, and the likelihood that you will be happy at the end is de minimis. De minimis. I've talked to plenty of entrepreneurs at UC um, who had started companies, did the 2 year thing, and then watched 10 years later when the company was sold or went public for $1 billion and they got zero, like literally zero. So it's not just about like, will it be successful? Is it how much success do you personally want out of that pathway, if that makes sense? I mean, my advice is get a business partner early on, so who really will, know you and know the technology and can serve as an intermediate to talk to investors and business development people. But don't go 2 years out after Catalyst and then pop your head up and say, oh, gee, now what do I do? These are all things, you know, in academics, everything is linear. You do your fellowship and then you get a grant and you write a paper and you get a promotion and you write a grant and get another promotion. That's not the way it is in startup world. You need to do everything all at once. So the same time you're in your lab working, you need to be finding a business person or an engineer or whatever to join you, right? You need to be learning all of these things, regulatory. You take Stephanie. You take Stephanie's course, which is wonderful, and there's tapes. So plenty of ways to learn. I don't like it when I hear someone say, "Oh, I can't learn all that stuff. I can't learn patents." Yes, you can. It's not that hard.
Yeah. Thanks for that. Great answer. Gemma Rooney, I see you have your hand
Hmm.
up.
I do. Thanks, Charles. And thanks for the talk, Michael. It was great. I have a question about the business partner. When our scientists are looking for a business partner that complements them and what they bring to the table as founders, what are the characteristics or traits that you recommend our scientists look out for in that partner? Because I'd imagine that a relationship like that could make or break a business.
Absolutely. I mean, the first thing I would say is they need to know a lot more about their stuff than you do. And sometimes ego makes that extremely difficult. So you need to be willing and able to give up control. Therefore, the person has to be extremely trustworthy. And I don't suggest like finding somebody and signing them up, 2 days later, work with that person for 6 months. Again, it depends a little bit on the space. You want someone who has experience in this space or at least experience with startups or experience in bigger companies, though that's questionable whether a big company, VP of engineering can now go do a startup because you don't have the same resources. Um, uh, so it's sort of like if you look at the spectrum of things that need to be done, jobs that need to be done, it should be someone who can finish that where you end, right? But that makes sense.
Great, thank you.
I think Iram had her hand up at some point. I don't know.
Yes, Tamiko.
Yes. If I may piggyback on that question, where would we find individuals with this business savvy, trustworthiness, with the ability to know about your scientific product as well or better than you do. I think most of us are more in the healthcare area, and yeah, so your recommendations for finding an individual with these skills and yeah, and like those characteristics.
When I first started my company, and no one was doing it, was in '96. And, a few years, people thought I was crazy. Why would you do this? You're tenured faculty. And then about 5 or 10 years later, they go like, how do I do that? And my answer was typically, if you have to ask me, you probably can't. So I won't necessarily give you that answer to this question, but it's about almost a career's worth of just networking, going to meetings, talking to people like me or other people on this call and say, hey, do you know anybody? Gemma and their group can help, but they really have a very, very narrow view of sort of what's out there. So it's just, there are meetups for various, if you're in digital health, there's all kind of meetups you go to. Somewhere in your life, an investor, a venture capitalist, somebody that your kids go to school with or whatever. So it's just kind of making those network connections. One of the things it kind of plays into this, people will say, well, I can't tell anybody my idea. How am I going to find anybody? I can't tell anybody my idea. I don't know of any technologies that have ever been started into a company that were stolen from somebody. When you look at how much effort it takes to get this thing done, very rarely is anybody going to steal your idea. Besides which, what comes out the other end is not going to be the idea you started with anyway. So, sign an NDA if you're really going to show people your science. That's something you can absolutely do. And our website has NDA forms. Absolutely do that. But don't be afraid to kind of give people the broad vision of what you're trying to do. And just, spread your wings out and network. That's all I can really say. There's no repository of them. There's no registry of them. It maybe is the hardest thing. Even harder in some cases than financing is finding a good business partner, a good co-founder.
Great question. Thanks a lot, Michael. And I see there's there's something in the chat from Stephanie Maris that Michael just alluded to. And
there you go.
As she says, she hosts these monthly innovator and entrepreneur hangouts right here in the Genentech Hall or Buyers Hall that Michael was referring to. And I've gone to several of these and I can recommend them. So thanks a lot, Michael. Really was very thought-provoking, as I already said. And so I'm going to turn it over now to Darren Cooke, who I see on the screen. So take it away, Darren. And I see Darren's tapped something into the chat as well that you can check out at your leisure. Thanks.
Yeah, so just on the topic of finding co-founders, I used to run a program called Bio Startup Speed Teaming. That was a Berkeley program. Recently been imported over to QB3 and accepting applicants from UCSF, Santa Cruz, basically the whole Bay Area. The amazing success story here is that I had a MBA student meet a postdoc back in 2021 on one 10-minute Zoom meeting. They hit it off. They had coffee. They did the I-Corps program. They did Skydeck Pat 13. They raised some money. They became a Baker Labs tenant. They just landed a BARDA contract for $226 million last week. Holy smokes. And it was because they met in one 10-minute Zoom. Anyway, QB3 is running the same program, Bio Startup Speed Teaming. So I'm not sure. I passed this off. I'm not sure the applications are still open. Oh yeah, they're open until November 12th. So check it out. Anyway, thanks, folks. Thanks, Charles. Thank you, Michael, for the presentation. I hope that my talk, I've been asked, and Charles, I don't know if you've seen this presentation. Yeah, I've given a lot of different ones, but this is, my presentation for simplifying the message, the best practices for a compelling investor pitch, which is kind of funny to do this right at the beginning, but stay tuned. Let me give you a little bit of background. Charles did go over a lot of this already. I run the Life Sciences Entrepreneurship Center at UC Berkeley and have for a number of years. And that's where the speed teaming event came out of, and venture grant program, and we're building biotech companies. On July 1st, when my predecessor, the Chief Innovation and Entrepreneurship Officer for the Berkeley campus, became the chancellor of the campus, yeah, that's Rich Lyons, I moved into his role, at least on an interim basis. So that's currently another thing I'm doing. I also teach, just like Charles said, I teach at Haas. This fall, an MBA course, which I just want to point out a funny coincidence. One of my teams, this is a customer discovery course, interviewed Michael Lesh last week, just coincidentally, as an expert. So this viral breathometer team came in with, in the customer discovery course, you do a bunch of interviews. So fun fact. So I've taught customer discovery courses for the NIH and the NSF for a bunch of years. I used to run the bio track at Berkeley Skydeck upstairs from where I'm sitting right now. I ran med device and digital health at a large seed stage investment group, Life Science Angels, for a number of years. And as Charles mentioned, and because I sometimes forget it myself, I'm an IP attorney and have been for a bunch of years. So let me jump right in. This is my talk about what I think is the ideal investor pitch. And the way this came about years ago when I was invited to a conference on behalf of Life Science Angels, and they said, "Hey, you've got 5 spots. You can meet with five companies." And they put the call out for who wants to meet with me. Like, well, heck yeah. I got 100 companies wanting to have one of the 5 spots. And the organizers of the conference literally sent me 100 pitch decks. I'm like, well, that's something. And I sat down and I read 100 pitch decks in one sitting and picked the 5. And I went back and thought, what was it about those 5 that made me want to meet with them, use up one of my spots for this meeting? And I boiled it down to 10 things. I've now seen hundreds and hundreds of pitch decks. I mean, typically Skydeck gets about 300 applications on the bio side of things for every 6 months. And normally I would sit down and read those over the course of a weekend. So the 10 slides that I came up with back in 2017 continue to this day as what I think is the ideal pitch deck. However, if you think about this presentation may not be just to investors, right? I mean, this is really for anyone who you want to convince you're doing something worthwhile, which could be collaborators or future employees or people you want to recruit onto your team. It could be your future CEO, or crucially also yourself, right? I mean, you want to be sure that you're spending your own time wisely. Anyway, this model presentation is broken down into 10 easy steps. The first 5 makers and breakers of the deal. If you don't have the first 5, if you can't get through the first 5 points, I would suggest even literally the first 5 slides, you don't have a company. So what are they? Number 1, you start with the problem. And this seems obvious, right? Like, who wouldn't start with the problem? I'll tell you, when I sit down and look at deck after deck after deck, it's amazing how many will start with the team or the tech or their IP position or something. But no, keep in mind that most investors that you're pitching to will have seen a bunch of decks, and yours is one of many. You got to reframe it, right? Remind us that diabetes is a big issue, right? It's a problem. And truly, it's a big issue, right? Even if it's obvious, that heart disease is a big problem. Put numbers and dollars and patients and geographic scope around it just to refresh us, even if we all know it, right? Number 3, you have a solution. You've literally fixed it. Like, this is where data comes in, and this is where you need to prove it to us. So I like to think of investors as professional skeptics, because we need to pass on 99 out of 100 deals. We want you to win, but we're also looking for a reason to say, oh yeah, this doesn't seem to be one of the winners. If you can convince, I also like to use this analogy of, how everyone has a frenemy, like some colleague who is maybe slightly jealous of you. If you can convince her that you fixed the problem, that's the level of proof that we want to see as well. Your investors are your frenemies. So 4, it's exceptional, 10 times better than anything anyone has seen before. And I don't mean like, yeah, maybe 10. I mean actually 10. So I remember being in a presentation for a company that had come up with a more efficient CHO cell, right? And they're saying, look, this is a big deal, right? It's 5 times more efficient over whatever's on the market right now. And I'm like, wow, 5 times, that seems like amazing. Shouldn't we all be excited about this? All the investors in the room were like, boo, 5x, that's terrible, right? And truly, investors are looking for a 10x improvement over whatever the status quo is. By the way, I just mentioned the status quo. Everyone's biggest competition is the status quo. And I don't put this here. I think maybe I loop back to this at the end. Don't be afraid to put the competition up front. Number one, it qualifies that you have a huge problem, right? If everyone's working on it, it must be a big deal. And number two, it gives you the opportunity right then to 10x them, right? You say, hey, this is a huge problem. Look at all the people working on it. Look how we're 10 times better, right? This
Hey,
is your
Darren. Do you think you're showing slides or not? Because they're not showing if you are.
Oh my gosh. What? Well, that's a good question. I thought I was showing slides. Did I not share?
That's okay. You're about to.
Oh my gosh, that's funny. I mean, it's funny in a way that's not funny. All right. Okay, here's me. Right. Here's the title slide for the investor pitch. And it's to other people, including yourself. And there's a funny picture of a baby. Right. Okay, we're all on the same page now. Yep.
Yeah, we can see him. Thanks a lot.
Okay, makers and breakers of the deal. Problem, huge problem. Luckily, there's not a lot of text on these slides. You have a solution, 10x better, exceptional. Right. Okay, we're caught up. 10x better than existing solutions. And this is a good time to put the competition on there. All right. So number 5, again, 5 first slides, makers and breakers of the deal. This solution's irresistible to somebody, right? Who's going to buy it from you at a profit. This is a very generic statement, but this is where the investors lean in. Like, this is where we're all hoping, like, do they understand what they've got? Do they understand the market? I'm going to go into a bit more detail about how complicated a regulated and reimbursed market is in a moment, but this is where you need to prove it. So stay tuned for who all the people are who constitute somebody and how they're going to buy it from you at a profit, especially in your field, especially if you're regulated and reimbursed. But this is the crux of the deck. And note, I didn't say anything yet about the team or the IP position or the regulatory pathway. And those are all crucially important, right? But if you don't have the 10x solution to a huge problem and you have somebody who's going to buy it from you at a profit, then you don't have a startup. All right, irresistibility. This is one way I think about irresistibility. What you're thinking about in what you're doing in your lab, what you're doing in your code, is the goodness of your solution, right? Hopefully, this is going to be exceptional. Again, 10x better than anything anyone's ever seen before. What you don't control is the scope and scale of your customer's problem. This is what I teach at Berkeley. This is what I teach for the I-Corps program, for the NSF and the NIH, is to understand the scope and scale of your customer's problem. And again, in your field, many of your fields, there's going to be not just one customer, but at least 5 of them. And so what we're leaning in to understand is, are you in the green box? Right? We want to see how great the tech is, but then we also want to understand the scope and scale of the customer's problem. And hopefully, those are the people who have money to buy it. Right. Okay. So back to the 10 easy steps. Notice I didn't say anything about team and IP and regulatory, et cetera. Well, those are important, right? These are the value changers of the deal. They could actually be so crucial that they will kill the deal. But more often, these are going to be things that affect the overall interest and value of the deal. Again, looking for the first 5. Team that can do it. You've done it before. It's an exciting group. You can execute. Revenue. Typically, actually, in a life science presentation, I'll make this your regulatory pathway is known and doable. But again, whichever path you're taking for this presentation. Revenues are going to be incredible, and also your regulatory pathway known and doable, especially in a regulated, reimbursed life sciences, human health tech space. You're going to need the IP, right? So intellectual property, almost always in your space, it's going to be patents, gives you a competitive advantage, and you have FTO. But Michael just mentioned a bunch of different companies that are thinking about AI. Many times they don't have patents, but they're going to have a proprietary data set. They're going to have some training data that no one else has. It gives you a competitive advantage, unfair competitive advantage. And FTO, freedom to operate, means that you know what other people are working on, and that you're free of their IP. So this is a complicated thing and often expensive and time consuming to figure out. But we want to see that as well. Number 9, investment. Whatever you're asking, there's going to be an ask slide where you say, hey, in exchange for the money that we're asking for from you, the investor, is going to take us someplace neat and important, right? Different milestones will be reached. Different investors at different stages will be intrigued, but lay it out. Use of funds. And then finally, history of exits in your space. People you're pitching, especially this is a pure investor slide. If you're pitching investors, the reason they're doing it is to make money, right? They're not doing it to advance the science or to better healthcare. And many times in venture philanthropy, they are, but true financial investors are doing this to make money. And so this is the opportunity to remind them that other people like them have made money in deals like yours. So comparables, multiples, et cetera. So to review, the makers and breakers, the first 5, problem, huge problem, you have a solution, it's exceptional, it's irresistible to somebody who's going to buy it from you at a profit, right? The 6, the final 5, the team can do it, revenue is going to be amazing, or your regulatory pathway is known and doable, IP investment is going to take you someplace neat, and then history of exits. All right, with that, I've put in some slides here, and this is more for a demo day pitch. So I give this presentation a lot to teams that are going through programs at Berkeley, including at Skydeck, where they're going to stand up and give more of a 5-minute, super high-level overview pitch. So this is some of the style and personalization slides from that pitch. Don't be afraid of pictures and graphics, right? Big graphics, big pictures conveys a lot in a very short period of time. If you have a limited period of time to pitch somebody, it's very efficient to do it that way. And again, you're going to be thinking about pitching people who may not be super close to the screen. Again, you're going to be thinking about pitching people who are not going to be spending a lot of time reading your presentation. It's not a scientific presentation. So big fonts help. It helps to actually be yourself and be entertaining, and don't be afraid. Investors are real people too. And again, remember, they want to invest in you. They're looking for investments. They want to invest in people who they like and trust also. And so the way you can convey that is actually just be yourself. There's no reason to be stiff in investor presentation. Make it understandable. This is important just because many times I think we get so engrossed in our own tech and the own world that we think it's simple, blindingly understandable, because it's obvious what you're talking about. Most people you're speaking to are hearing it for the first time. So the test I give is if you can give the presentation to a smart high school student and they get it, that's probably the right level, actually, at least for a first meeting with investors. I'm going to skip that. Do it in 10 slides. Truly, go back. I gave you the framework for what I think is the ideal investor pitch in 10 slides. Even if you have 20 slides, I'm going to suggest put them in those order, in the order that I laid out, and compress them into just the main points on the 10 slides and see what it looks like, right? You can go on and add stuff and change the order and add additional slides, but just as a experiment, compress it down to the 10. So what I'm going to point out here, huge problem. Keep in mind that the biggest competitor for everybody is the status quo. So every problem currently has a solution, even if it's terrible. I think this is important to remember. Every problem out there is being solved in some way, even if it's a bad solution, if it's expensive, it's inefficient, even if it's so bad it's killing people. But you're asking somebody to do something different tomorrow than what they're doing today. And so, what, again, I'm going to reiterate this, if you put the competition up front, that really tees up like, how are they solving the problem today? What is the status quo? What are people doing, proposing to do in the future? Right. Irresistibility, somebody who's going to buy it from you a profit. This is when I'm going to suggest, think to yourselves, if I do this presentation live in a longer format, I'm going to ask people to shout stuff out. But who are, so I just said, you need to, right. It's irresistible to someone who's going to buy it from you at a profit. In your world, in the regulated and reimbursed world, that someone is many times multiple parties. Who are these 5 parties that must be an enthusiastic yes for a life science innovation to be adopted? I'm sure each of us have come up with a few of them. I'm going to suggest it this way. And this is what I have life sciences companies now do in my I-Core class, in classes that I teach at Haas, is to fill this out, right? Understand who are the people, first of all, who's the patient, the provider, the payer, the partner, and the permitter. And then, with specificity. And then guess, what would motivate them to say yes to do something different tomorrow? For many of these are easy, right? Many times the patient wants a better treatment, obviously. The provider, payer, and partner, well, that can get a little confusing, right? What would motivate them to do something different tomorrow than they're doing today? And what I want most people to realize over the course of the course, and I'm just sort of like giving you the like kind of spoiler here, is that for many times, a lot of the parties who need to be an enthusiastic yes in a regulated and reimbursed space, whether you like it or not, they're motivated by financial incentives. So, all right. Revenue projections are incredible, right? This is now just like kind of a point about the way we want to see what you're putting out in your slides. It's not uncommon, and it's actually, let's put it another way, it's very common for the market slide to be just pulled straight out of some market research report saying, look, cancer is a $2 trillion opportunity. And this is what we call a top-down slide. You say, look, some market research report did an analysis, and this is a huge market. Look how big we're in. Investors are not looking for that. We're looking for something that looks at your market from the bottom up, meaning a realistic estimate of how many people you can sell to at what amount. And that's your serviceable, obtainable market from the bottom up. It's common, of course, to leave it at just top down and say, hey, we've got a huge market. But what we really want to see is a sensible, simple math, bottom up slide. All right. With that, I just blasted through this presentation that I'm happy to answer questions about, and actually answer questions about anything else that's relevant.
Hey, absolutely great. Thank you so much, Darren. Very, very, yeah, just really great. And interesting, about those graphics, wherever you got them off the internet, somehow were just so thought-provoking since they're all from like 100 years ago. I really like that.
Yeah.
And then the font 30 point I really like, and then the 10 slides, and even if you have 20, try to put it in 10. So I'm looking at the screen if there's any questions here for Darren Cooke. The other thing I thought was interesting was your point about, high school, that you know the stuff, that one knows that stuff inside and out, and you kind of forget that other people don't. And so if you tailor it to that level, and what I was just thinking about was how what engineers learn is just so much different from what attorneys learn, and so much different from what physicians learn, so much different from what scientists learn, that even though when we're all in this healthcare med tech, digital health, medicines, drugs, and tests. But our individual skills around the FDA or toxicology or prototypes can be pretty at the high school level. I thought that was really good advice.
Yeah. I mean, so this is one of those things where many times, even if you're presenting to a very scientific investor, almost always it's not exactly their scientific field, right? So this is, they get it, but this is not something that they're studied up on. And truly, I mean, it's almost hard to take it to simplify it enough from the science. You can, of course, uh, increase the level of complexity on the science, have backup slides when you're asked, more specific questions about things. But at least at the first pass, it really helps to simplify even the scientific elements.
I want to reemphasize that, Darren, because how many presentations have we seen that kind of looks like a grand rounds presentation with a couple of slides slapped on either end? The TAM, heart failure is a big problem, and we're going to do great things, and then it's the science fair. I mean, even when I look at the Catalyst grants, I tend to look at the actual science last. I want to know, have they thought about the regulatory? Have they thought about an exit? Kind of what's the big picture? Because you're going to know a hell of a lot more about what you're doing than I am. So I'm going to assume that you know what you're doing. But later on, we'll dig in. By the way, I always tell people that the purpose of the first meeting is to get a second meeting. And so that's why the 10 quick bullet points is very helpful, because what you really want to do is go from the associate to the partner level, where then maybe there'll be someone who's an expert in your area that can dig a little deeper. But that's a really good point.
Yeah, I agree on that. A slight counterpoint. I agree with Michael. The goal is to have a future meeting, but you also don't want to leave out important stuff to say like, hey, yeah, they're going to be so intrigued that we're going to have a future meeting, and then I'm going to tell them this important stuff later. It's amazing how often that happens, where they said, no, we're not putting our best data in because we want to save it for the second presentation. Well, no, or they want to be asked for it or something. That never happens.
Yeah.
If it's not in the first deck, if your best data is not in the first deck, investors are going to assume you don't have it.
Hey, Darren, there's a great question in the chat from Tomika. And Tomika, why don't you just ask it out loud?
Sure. I didn't want to interrupt as you were speaking. I thank you again for that wonderful presentation about 10 tips to help us have a powerful, impactful, successful presentation. And I'm wondering if there are any tips for things that we should avoid, things we should not do that might sabotage us during this presentation.
It's hard to think of something where that would sabotage your presentation. There's certainly things that I would prefer not to see. It's not uncommon, especially for a European startup, to start with the team slide. It almost seems to be that's the format that they all follow. What really does sabotage a presentation is that many times I've seen a bunch of presentations, European or not, where they say, hey, look at this, the founding team, and then spend an amazing amount of time on it, introducing the team before they get to anything else that's relevant. That is a tough start to a presentation. I would always suggest leave the team for last, especially if it's an amazing team. Well, that's just going to be like a big surprise at the end, right? It's like, and look, we already set up how big the problem is and how great the solution is, and we're really the people to do it, and leave it as a reveal.
Fantastic. Thank you.
Yeah, thank you. Rupa, looks like you might have a question, Rupa.
Yeah, just based on like so many presentations that I've attended, and I want your comments. One is that being told that the slide deck, when you're presenting, keep it light, but if you're sending a deck, to put in more information. What are your views on that? And two, about reading a room and having enough time for it to be conversational versus just presenting without stopping.
Yeah.
And I'd like your comments and thoughts on both Michael
Yeah,
and
I'll bet Michael has
Darren.
thoughts on that too. But yeah, there's definitely a difference between a deck that you're presenting, a demo day deck, and a real like an investor presentation, a 20-minute investor presentation are different anyway. If you're sending out a non-confidential deck to investors where they don't have the benefit of you speaking to it, it's going to have a lot more text in it. I mean, just necessarily. I would suggest even a 20-minute presentation will be that same textful presentation. What's different is like a real demo day, just sort of teaser 5-minute, 4-minute. You may not have much text because this is going to go by so fast and it's going to be more entertaining than anything. So I don't know, Michael, you have thoughts on?
Yeah, no, I
deck?
usually have the deck I present, and then I have a send out version.
Yeah.
And by the way, I have a file. I don't know if you do this, but I make a new deck for each presentation. Because sometimes there'll be some changes and I want to memorialize that that's what I presented to them. And then I have like a PDF version that's a little longer. But more and more, the young people I know are sending out like videos like Loom and you know, so there are other ways now, and especially the 26-year-old tech VC may not even want to look at slides. They may want to just look at a quick video. So we've been doing that a little bit more.
Yeah, that makes sense. And the other question about whether you just blast through it without stopping or take questions in the middle, my experience is if it's going well, you'll be taking questions in the middle, right? Because then the investor is really interested. They're going to be cutting you off at every turn to say, well, whoa, hold up, go back to that. Let's look at that data again, or think about the market some more. That's a good sign, and I would welcome that. One thing I've seen occasionally, it seems to have come and gone, is startups that send out a link to a live deck, which is fine. However, rather than just a PDF or a PowerPoint, if looking at the deck requires you to submit your email address, no investor does that, right? Like you could send it out to a bunch of people. No one's going to be intrigued enough to say like, hey, yeah, I'm going to tell you that I've actually looked at this by submitting my email. No, investors want to do it anonymously. If you're able to do it with a link that lets you directly into the deck, that's fine. But otherwise, I think PDF is still the standard format.
Great. So thanks again, Darren and Michael, so much. Very, very excellent presentation and excellent questions. I also want to thank the Catalyst team, Sohaila and Rupa and Nate, for everything they do. And I want to thank all you people that dialed in today during your lunch. And feel free to reach out to any of us with any questions or any suggestions. And thanks everyone on the call very, very much. We'll see you later.
All right.
Thank you.
Thanks, folks.